Hello, I'm Dr. Kelly OMD. I am the Volunteer Medical Director for Vivalifehealthhub, which is a program under Logan Heights CDC. LoganHeightsCDC.org is a nonprofit 501c3 in San Diego that is focused on community development and strengthening our families and building stronger communities. I am here to discuss with you sexually transmitted disease prevention and awareness, as well as family planning, birth control, contraception, education. If you would like a longer version of this, please feel free to go to our YouTube page on Viva Life Health Hub, as well as our IG Facebook pages called Viva Life Health Hub. Or you can get a private or group consultation, and you can contact us through LoganHeightsCDC.org or info@Viva Life Health Hub. Just a real quick, brief discussion about STD prevention. So, sexually transmitted diseases are transmitted by having sex, oral, vaginal, or anal intercourse or sex. And there are two ways of preventing sexually transmitted disease transmission. That is, number one, 100% prevention is by what? Abstinence. So if we do not have oral, anal, or vaginal sex, we will not get a sexually transmitted disease. A couple of sexually transmitted diseases that we may or may not know about are viral, which means that you cannot get rid of these. A few are hepatitis, HIV, and herpes, or bacterial, which are gonorrhea, chlamydia, and mycoplasma. Bacterial infections we can get rid of with proper diagnosis and treatment. Now let's go to family planning, contraception, birth control. So when you want to get ready to have a child, there are several things that you need to do. Number one, have great nutrition and cardiovascular health. So we need to make sure that we are eating healthy and we are exercising on a regular basis, at least 150 minutes a week. The other things that we can do are to help prevent having children is utilizing any of these methods of birth control. So the most effective are at the top, the least effective are at the bottom. As you can see, most effective is this row, and that can be an implant called a Nexplanon. It goes into your arm, it's progesterone only. It can be an IUD, and that can be progesterone only or copper. So hormonal or non-hormonal IUD, and that goes inside your uterus. You can also have your tubes, which means for a female, your fallopian tubes, or for a male, your vas deferens, cut, burned, or tied. The next effective way of preventing pregnancy or planning for a family are to use the Depo-Provera shot. That is a shot that you get every 3 months. You can use birth control pills, which you take by mouth every day. You can also use something called a patch, and it goes on your arm or any part of your skin that you would like to keep covered. And also something called a NuvaRing, which actually goes inside of your vagina. All of these have hormone in it. The next way of helping to prevent pregnancy as well as sexually transmitted disease is to use a condom. Condoms are female or male condoms. Next, you can use a diaphragm, and this is only to help prevent pregnancy. This was very popular several decades ago, and there still are people that utilize diaphragms because they do not want to have hormone in their system. You need to be well trained in order to place a diaphragm. At the bottom and least effective are spermicides, which are substances that you place into the vagina to help kill off sperm. This does not prevent sexually transmitted disease, as well as the withdrawal method, which means that you do not have semen or ejaculate in the vagina. Lastly, the last two things are in an emergency, if you've had a broken condom or you did not use a regular form of birth control, you can use Plan B. So this is emergency contraception. We do not recommend that you utilize this on a regular basis as a regular form of birth control. We do recommend that you utilize it only if you are in an emergency. So within 72 hours of having unprotected intercourse, we recommend using the Plan B. Also, natural family planning. So, natural family planning is when you utilize your ovulation calendar. So, every single month, a woman typically ovulates or releases an egg into her fallopian tube, and the semen the sperm and the egg meet and they create a baby. So, if you count out your days of your menstrual cycle and you're able to understand when you're ovulating, then that is called natural family planning, and you do not have intercourse around that ovulatory period. So those are the major ways to, number one, prevent sexually transmitted diseases. Remember, only the condom is the way that you prevent sexually transmitted disease, as well as prepare for having a child or trying to help prevent having a child. Using birth control is the way that you family plan and prevent from having a child. If you would like more information on any one of these methods, you can always contact your private physician as well as your primary care manager, who can be your nurse midwife, your certified nurse midwife, as well as your PA, women's health nurse practitioner, or family medicine physician. You can go to any one of their clinics or a public health center or a family health center. And if you would like more information from me, you can contact me at Dr. Kelly OMD at info@vivalifehealthhub.com, on Facebook or Instagram, Vivalifehealthhub, as well as 619-858-0563. Lastly, you can also use LoganHeightsCDC.org as a resource for building strong families and healthier communities. We hope you have a wonderful day, and don't forget to do what? Viva Life. Bye-bye.